one of the most important things that a patient has to do to feel good about their relationship with their doctor is to understand what it is that they want to get out of the relationship. And they need to feel comfortable with their doctor. They need to feel like they can tell them anything.
I think it's a team. I'm in the driver's seat. I look at Dr. Charles being right next to me.
I certainly will try on my end. I'll meet patients more than halfway to try to help them develop a relationship.
You know your body. You know if something is not feeling right, is not acting right, and it's up to you to share that information with the doctor, because my health counts.
Major funding for My Health Counts provided by Blue Cross Blue Shield of Western New York. Take time to exercise daily. Eat healthy and reduce portion sizes. Limit TV and computer screen time. With additional funding provided by Catholic Health System. See us in a new light. Atwal Eye Care Associates. Change the way you see. And the McGuire Group, offering 24-hour skilled nursing care with 5 convenient locations in Western New York. With foundation support by Aligning Forces for Quality, an initiative of the Robert Wood Johnson Foundation. The John R. Oishei Foundation, a catalyst for change. And the Robert J. Stransky Foundation. Produced in partnership with the P2 Collaborative of Western New York.
Nothing matters more to most of us than staying healthy and keeping our loved ones healthy too. Getting peace of mind about health care begins largely with finding the right doctor, one who values relationships based on openness and trust and provides high-quality care. I'm Susan Hunt, and today we'll give you the tools you need to become a more able, skilled, and confident manager of your health. We'll show you how to get the most out of your doctor's visits and help you know what questions to ask and where to turn for information and guidance.
People spend more time thinking about much less important parts of their life than they do who they're going to see for health care.
Partnership is a much more effective way of delivering medical care. The paternalistic approach that had been probably advocated many years ago is not one that most of the patients that I see would like to be involved with. They'd like to know what options they have and what are the consequences of each option.
Comfort and fit. Is this somebody who can spend the time I need with me? Can they answer questions the way I need them? Will they refer me to other partners within the healthcare delivery system? Will they help me to navigate through when things are difficult, not just when things are good? Do I feel comfort and trust in this relationship?
The partnership takes place for a lot of different reasons, but one is to make sure that the care that they need is delivered. The expectations that they have are met. With certain things, I'm not going to cure diabetes. I'm not going to cure hypertension. Those things I can't cure, but we can treat them to the point that you can live a normal life.
Patient with diabetes in the United States is going to be on. I like to remind people about where they have power, what things they control. And oftentimes it's more than you think it is.
Between the 75th and...
Your doctor is the expert on medical care, but you are the expert on yourself. Working together, you'll find the best solution. And I'm joined today by Dr. Michael Edbauer and patient advocate Trisha Torrey. Great to see both of you. And we're going to talk about partnering with your doctor and other members of your healthcare team. I love this subject. And Dr. Edbauer, partnering with your doctor, now that's a novel idea. What exactly does that mean to you?
Well, I think it really defines the whole relationship between the patient and physician, and it really should be viewed as any of our other partnerships in life, whether it's a business relationship or probably more accurately a relationship you have with a loved one. And that really means it's something that has to be established over time. There has to be a basis of respect between the two individuals. There has to be openness so that there's ability to communicate, and I think those are the things that really build the fundamental structure for it.
I would add to that honesty. So often we go to our doctors and the doctor will say, "Oh, have you been getting your exercise?" "Oh, sure I have," and maybe or maybe that's not true.
I introduced you as a patient advocate. How you became one is such a fascinating story to me.
I had nothing to do with healthcare whatsoever. I was a marketing consultant. In the summer of 2004, I found a lump on my torso about the size of a golf ball, had it removed, was called 2 weeks later and told I had a rare aggressive lymphoma and my life would be measured in months and not years. And it took me about 3 months, but I was able to show that I did not have cancer at all. It was a very scary proposition, and I decided that if it could happen to me, it could happen to just about anyone. And I decided that I was going to do what I could to make sure that other patients wouldn't have to go through similar kinds of things. And that's why I do what I do now. I go out and speak to people and help them get through the healthcare system and partner with their doctors.
Mm-hmm. Doctor, when patients come in to see you, how do you sort of begin to form that relationship? What are you looking for in those first moments of meeting a new patient?
Well, I think one of the most important issues is really to make the patient feel comfortable, that to, through my actions, allow them to realize this is truly a partnership. Mm-hmm. So it's little things, sitting down at the same level, not standing while they're sitting. Possibly, if it's able to do so, have the patient clothed when you're initially talking to them if it's the first visit, so there's a sense of being on equal playing field. And then really getting a sense from them, what are they looking for in their overall delivery of health care.
So it's okay to really want to feel that you're part of your own health.
Well, you know, 50% of the equation is us, and we're the ones who know our bodies. The other 50% is our doctors, and they're the ones who know medicine and have studied it. And if you don't work together to put that 100%, you're not going to get 100% of the care you need. A lot of it, I think, has to do with the patient coming in and claiming that, I use the word empowerment. You need to make sure that you are claiming your part of the equation, because the doctor can't do it for you.
In your careers, you will conduct approximately 150,000 patient interviews.
Patients enjoy knowing that future generations of doctors are being trained to communicate better.
Use open-ended questions, nonverbal encouragement, things like eye contact. Lean forward to the patient.
We're very lucky to have a very active clinical competency center where we teach students to interview patients and examine them right from day one of their medical school education.
Hello, Ms. Smith.
Hello.
My name's Lynn. I'm a medical student.
Mm-hmm.
How are you? The first time you see a patient, you're so nervous. Getting through that barrier and feeling comfortable with reaching out and being more of a friend, a support system. That standardized patient is so crucial in getting you through that.
It looks just like an exam room, like a doctor's office. However, there are cameras. It's very helpful for a student to be able to get immediate feedback on their performance. We're applying some of the basic sciences in a clinical setting, which makes it come alive and stick. And we're also working on the art of obtaining the story from the patient.
I think over the course of the years, realizing that, you know, getting that blood pressure, washing your hand, listening to the heart, that's really great, but what the patient cares about is that conversation he or she is having with you.
It was a thing that kind of started behind one eye. I had like this pressure feeling.
That makes you realize that each interaction you have with the patient really makes a difference in that patient's life.
How can we best prepare? I mean, we tend to think that preparation entails scheduling the appointment, but there's so much more involved.
A lot of the preparation means getting things written down before you actually go to see your doctor.
Before the visit, sitting down as the patient saying, what do I want to get out of this visit? What are my goals? It may be just to find out that everything is still okay, or you may have some very specific questions, and to write those down to make sure they're addressed during the course of the visit as well.
You start to have some symptoms, write down when they've started. If you can figure out what the triggers are, write down what those triggers might be. Write down questions you've got.
So I think we have to be really very proactive about saying it's okay to be, you know, the collector of your own information.
It is. You really want to have a whole list of past medical information to help your doctor in your care. Part of it includes things such as medications, would include over-the-counters, would include herbal supplements. The other part, allergies to medications, food allergies, past medical history, if you've ever had any surgery, have you been treated for medical problems, your extended family history, your mom and dad, your siblings, any disease that tends to run in the family. All that is very helpful. And oftentimes, not only for your first visit, but if any of those parts of the history have changed since your last visit with the doctor, to update us so that we're aware of that as well. It's always probably better to assume we don't know than assume that we do know these components of your health.
So many people wait until there's a catastrophe or some major issue before they assemble all of this.
I always tell people the holidays are a great time to collect information about your family. First of all, everybody's there presumably for a good reason. It's just a good time to kind of break the ice and say, you know, I was thinking back to old Aunt Ida, and I don't really remember what she died from. And,
exactly.
You know, start the conversation that way, and then maybe take a little serious turn, but then take notes. And you've got them, and then share them with your other family members, share them with your siblings, share them with your children when the time comes.
So many people, I think, forget to ask, and then, you know, parents die, grandparents die, and you don't know. With a written record, doesn't that also include any test results and x-rays? I mean, how do we get those? Can I?
Yes. You know, legally, you have a right to get those. I tell patients when you go to get a test or when you go to the doctor, tell them you want a copy of the test results or the notes the doctor's taken. You won't always get them right then and there. Sometimes you will. If they're using electronic health records, that kind of a thing, you can. But it's your right, and it's not only your right, it's your responsibility. You should be the person keeping track. You should be able to take them back to your primary care physician in case copies haven't been sent back.
Is there one particular way to assemble all your information? I mean, now we have electronics, now you can throw it on the internet. What's the best way to do it?
Can really be any format that you want it to be. I mean, I think whatever works best for you to record your information, and that's really the key. What's easiest for you as the patient, because that's what you're going to be able to maintain.
And I think what we're really all talking about here is pretty basic stuff, which is that everybody's on the same team, and the goal should be your good health, plain and simple.
I remember when I was first diagnosed in 1990, at that time I actually ended up bedridden. The lupus had affected all of my connective tissues and all of my joints. And it wasn't explained to me by the doctor exactly what it was and what it meant. So I thought that I was going to be like that forever. I didn't know that it could get better with treatment. Going to support groups and their educational programs, I got to learn from other patients how to manage my own disease. There's a lot of lifestyle changes that I had to adapt to in order to make sure that I didn't get myself into a situation where the symptoms might get worse. I have very good relationships with my current doctors.
Down this way, any pain in the shoulder?
No, it feels
I know
good.
you're doing those exercises.
It wasn't always like that. I've had doctors where information wasn't readily received from me. Right now, I'm managing my illnesses rather well. It took a long time to get to that point. I actually have this neat little tool. It's a loose leaf notebook, which is divided into sections. It has a section for your family history, a section for your medications, a section for your past lab work, your past surgeries, all the things that they typically ask you, especially when you're going to a new doctor and they give you like 5 sheets of forms to fill out, and you're sitting there and you're trying to remember all of these things that happened in your lifetime.
If you have X number of minutes with your patient, if you can quickly go through all of the information in a very organized fashion, then you can move on to things that are more important or things that sometimes other doctors may not be able to address.
The information you share is really key to the action that your doctor is going to take.
No change? We went from 4 tablets a week to 3 tablets
down
a
to
week?
3 now, yeah.
Good, good.
You know your body better than anybody else, so pay attention to your body, to the signs and the signals that your body gives you, and make sure that you record those things either in a daily diary or on a notebook so that you can relay that information to your doctor.
Anything that a patient can do to help the doctor help herself or himself should be done.
Empowering yourself to be a better participant in your own health care means trying to make yourself the ideal patient. What's an ideal patient?
Well, I think there's several characteristics. The first, and probably the most important, is coming in with good questions. The second part is to be a good listener. So in addition to giving the information to the doctor, also listening when you've asked a question, there's a response coming back to you.
The doctor says, I think you have this. Ask the question, what else can it be? Mm-hmm. And then discuss why the doctor chose the one the doctor chose. And then ask questions like, all right, what do I need to know about it? And then maybe the third question is, and now what can we work on together to get past it or to manage it or whatever it would be? One of the big complaints I hear is the doctor uses words I don't understand. All right, so you sit there and the doctor's talking to you about a diagnosis or a treatment, and they use a word and you're afraid to stop and ask. And if you just stop and say, "Doctor, can you tell me what that means?" I think, first of all, the doctor appreciates the fact to communicate that much further, but secondly, it's so empowering. You feel emboldened almost by it. And then that leads you to the next. You're not so afraid to ask the next question.
I always liken it to the fact when I go to a computer store and the salesman might be starting to talk in tech terms and I get completely lost, and it can be a little intimidating. And so I may have to say, you have to put this in language that I can understand. That's fine to do with your doctor. And again, it's very helpful because it kind of resets, helps us to realize that we just kind of missed you in our communication and we have to kind of change our direction of where we're going.
You know, another thing that we run into, I hear patients telling me that their doctors have interrupted them, and that's very intimidating to them. And it is an intimidating situation. And I always say, you know, again, you need to listen, but then go ahead, don't get derailed. Go back to whatever your question was and say, "Thank you, doctor, but can I go back and finish asking my question?" Be polite, but certainly make sure that you don't get derailed.
Now you're in the office visit. Perhaps you're looking at some test results and there's a diagnosis. Now we go to the next step, which is, I presume, setting a goal.
Absolutely. And this is really something that has to be done in collaboration. Medicine is not often cut and dry. It's often a gray area. And so you really have to talk with the patient about the different ways to approach the problem and what they want to achieve out of the treatment plan. And it could be something where there's side effects of the medication therapy, and so the patient has to have their input whether they're willing to go through that particular set of instructions.
You know, one of the things about actually following through on the treatment is that if you're part of the negotiation team to begin with, you're more likely to do that. And there are many times, I think just like you say to the doctor, what else could it be in response to the diagnosis, you might also say, what other treatment possibilities are there? And then figure out which one works the best for you.
And part of having a contract and a commitment is also obtaining more knowledge about what's going on. And that can be done in various ways, can it?
The office visit is really just the beginning. If you've been diagnosed with a new disease, it's going to take weeks, months possibly to really completely understand all the complexities and the ramifications of it. So part of my job is to give you resources so that you can go out, learn more about that given disease and or its treatment, and then come back to me with more focused questions so that I can take you to that next level so that our partnership can have the most value.
And you know, there are a whole group of people in the doctor's office quite often you can tap into. Just because you only get 8 or 10 minutes, whatever it's going to be with your doctor, doesn't mean there aren't other resources right there at your doctor's office. Look for nurse practitioners. Look for educators, nurse educators in a lot of cases. There's plenty there for any patient who wants to empower him or herself.
Well, whether it's the internet or support groups or the library, the most important thing is know where you're headed and seek out the information so that you become much more engaged in the direction you're going to take your health care.
Right now I have degenerative disc disease. It was very hard because I had to stop doing a lot of things that I used to do. They told me that I would probably have to have spinal surgery if it got worse and if the pain was too hard. So then I started coming to Dr. Ziegler for acupuncture to see if I could relieve some of the symptoms and put off this suggested surgery.
So what I'm treating Lori for today is her chronic low back pain, and she's also got some pain in this knee today. Lori's a patient that it's really easy to partner with. She's very proactive in her own health care and deciding what kinds of things she wants to do. She does a lot of research, and she's very well informed.
Dr. Ziegler is really good. She listens. I have chosen my doctors very carefully.
Did you ever break this ankle?
No.
It's a talking back and forth, listening, sharing, and coming to a decision together about what kind of treatment to do for the particular problems. There. I think that the acupuncture is really helping her. It's becoming much more well accepted. It's becoming much more common.
There. I have friends and they'll say to me, "But you do all these things." I says, "Yes, I do some of them with medication, some of them with acupuncture, some of them with chiropractic treatment, some of them with massage. And all of these things keep me going."
We've been having some amazing dialogue about creating a partnership with your doctor and your healthcare team. And at what point during that collaboration, if you will, that relationship building, do you sit back and assess it and make sure that it's working for both parties?
Well, I think you need to assess it on an ongoing basis. And in fact, you're probably making little assessments every time you go in to see your doctor, and your doctor doing the same thing. And for the most part, things probably kind of just move along in a hopefully positive way. But if you do begin to detect that there's areas that you would like to see improvement, one of the two has to really come forward and let the other party know that there's a problem within the relationship. And this may mean that the patient's saying, I really want to play a greater role in the care that you're providing to me, and maybe even have suggestions of how they'd like to become more involved.
Sometimes you have to move on, and if you feel like you've done everything you can, to the extent that it can be repaired, then it is time to move on and find yourself another doctor.
All right, so the foundation is broken and you're thinking, oh no, I have to go find a new primary, which isn't always easy, is it?
Right. Well, I think for the patient with insurance, the best place to start is really with your insurance company. They have a list of physicians who are covered within your plan, and then you can take a look to see who's within a reasonable geographic area, that type of thing.
It's hard, isn't it?
It is, and you know, there are a couple of things that I recommend to patients. I do think it's very valuable talking to other patients who maybe have the same health conditions, problems that you have. But you need to be able to distinguish nice versus capable.
Are we able to go a little deeper than this is my name and this is my address?
Each state has a website that talks about the licensing of doctors. You can learn about the doctor's credentials, where they went to medical school, how they're licensed, whether or not they're board certified. That's a good place to start.
What about someone who doesn't have health insurance but should have a primary? What do you do?
Well, that's a real challenge, and I think part of the way you can address it is go to some of the governmental websites to be able to see who are the physicians in a given area. Then you probably are going to have to do some phone calls to find out if they'll accept patients without insurance, to see what's available, and also realistically to find out what it's going to cost you to come in as a patient to receive services.
But the point is, do it. Is it different when we're choosing a specialist over a primary?
Well, I think it's a little bit different for a specialist. In that case, I think you want to really begin that conversation with your primary care doctor. Hopefully, if you have a strong relationship with your primary, they'll already have a sense of the type of doctors that may work for you. In addition, they're going to have a sense of who are the doctors who they feel comfortable with from a medical expertise point of view for the particular problem that you're addressing.
Let's say that you're ready to find Dr. Wright and you've identified him or her. Well, you've got that first date, don't you? Because you don't get married on the first date. So, again, it's kind of coming full circle.
I think in that first encounter, you're really checking out to see if this is something that's likely to be able to move forward. And it may be some very basic things, the hours of operation of the office. And then beyond that, it really is the sense of whether you feel that there's a sense of connectedness between the patient and the physician.
So if you start a new relationship with a new doctor, try to do that when you're healthy, just to assess how well you can partner, how well you can discuss things, how open and honest you feel like you can be, how respectful the doctor is with you. If you can do that when you're healthy, that at least puts you on a more solid foundation for when you do get sick.
Most importantly, don't wait until an illness strikes or a catastrophe occurs before you do this. While you're healthy and in that current relationship, if you are thinking of getting out of it, that's a time to start looking so that you're not doing this at the last minute. But again, great dialogue about really how you define Dr. Wright.
Mm-hmm.
I called my doctor, and he told me to go to the emergency room. My glucose numbers were between 1,300 and 1,700.
Ken was just really in a bad way, so you knew instantly that there was, going to be an issue that we needed to address.
I think it's a team. Dr. Charles was very instrumental in helping me go through this process. After I found out that I was a diabetic and was going through my recovery, I got on the internet and tried to learn different things, and I would ask him questions.
I think it's a really good opportunity for a guy like you. It might drastically reduce how much insulin you need, and that would be great,
All right, is that something we should try?
I think we should get it going for you.
I look at him not only as a physician, but as a friend, and I can go to him and tell him anything. I'm in the driver's seat, and my role is staying on course and doing what I'm supposed to do. It's my goal to live a long, healthy, productive life.
Life is full of decisions, but few are as consequential as those we make about our health and health care. We can't just sit back and wait for good health care to come to us. We all need to embrace the attitude that my health counts. The relationship you establish with your doctor and other members of your health care team is the cornerstone of good treatment. They can be your most powerful friend, ally, and coordinating agent in the healthcare system. Keep in mind that you are the most vital member of your healthcare team. You know your body, you make the decisions. Armed with the information and tools we've talked about today, you have the power to get the best care. Take some time to visit our website and learn more. I'm Susan Hunt, and I thank you very much for watching.
Major funding for My Health Counts provided by Blue Cross Blue Shield of Western New York. Take time to exercise daily. Eat healthy and reduce portion sizes. Limit TV and computer screen time. With additional funding provided by Catholic Health System. See us in a new light. Atwal Eye Care Associates. Change the way you see. And the McGuire Group, offering 24-hour skilled nursing care with 5 convenient locations in Western New York. With foundation support by Aligning Forces for Quality, an initiative of the Robert Wood Johnson Foundation. The John R. Oishei Foundation, a catalyst for change. And the Robert J. Stransky Foundation. Produced in partnership with the P2 Collaborative of Western New York.